Hi, you guys. Welcome back for our daily practice questions. It is day 71, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And as a reminder, my upcoming FMP and AGMP 5 week intensive review starts April 21st and runs through May 30th. So if you're looking to get one of these last slots, make sure you click the link to enroll. All right, so question number one states a 30-year-old male presents for routine screening with the following hepatitis B serology results. The HBsAg is negative, the anti-HBs is positive, the anti-HBc is negative. What is the most likely interpretation of these results? Is it A, acute hepatitis B infection, B, chronic hepatitis B infection, C, immunity due to prior vaccination, or D, immunity due to prior infection? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to assure you're answering what is even being asked of you. So here the stem of the question states, what is the most likely interpretation of these results? So let's walk through it. All right, so the surface antigen is negative, so we know they do not have the infection, right? The anti-HBs is positive, so they have antibodies either from having the vaccine or previously having the infection. And the anti-HBc, which is your core, is negative. So that lets us know that they do not have prior exposure. Remember the core, the little c, is your IgM, your IgG. So when that's negative, but the antibodies are positive, that anti-HBs being positive, that lets us know they must have been vaccinated. So the best answer is C, immunity due to prior vaccination. Question number two, a 45-year-old woman presents with hepatitis B serology results as follows. The HBsAg is positive, the anti-HBs is negative, the anti-HBc IgM is positive, and the anti-HBc IgG is positive. What is the most likely diagnosis? Is it A, chronic hepatitis B? Is it B, acute hepatitis B infection? Is it C, immunity due to prior infection? Or is it D, recent Hep B vaccination? Take a moment and tell me what you got, y'all. All right. So again, stem of the question states, what is the most likely diagnosis? So let's run it back and see what we have. So the surface antigen is positive, so we know they have the infection, right? The antibodies are negative, so no vaccination, no prior exposure. Now the core, the IgM and IgG is positive. Remember, and I'm running it back to try to keep y'all repetition. I always say repetition is the key to retention. Trying to keep it in front of you so you can know how to apply this. Remember, we did this on yesterday. IgM is positive, letting us know what? It's acute, right? IgG being positive, you think chronic. But when you see both, I want you to think it's an acute hepatitis B infection because oftentimes in the beginning stages, the IgG will show up positive along with the IgM. If the IgG was positive by itself, then you would think just chronic, right? So just in case you see it in this fashion, but the best answer is B, acute hepatitis B infection. All right, and lastly, question number three. A 50-year-old patient's hepatitis B serology results are as follows. The HBsAg is positive, the anti-HBs is negative, the anti-HBc IgG is positive, and the HBeAg is negative. What is the most likely diagnosis? Is it A, chronic Hep B with low viral replication, B, acute hepatitis B infection, C, chronic hepatitis B with high viral replication, or D, previous hepatitis B infection with viral clearance? Take a moment and tell me what you got, you guys. All right, so the stem here, what is the most likely diagnosis? So let's see what we have. Our surface antigen is positive, so we know we have the infection, right? The antibodies are negative, so we don't have any prior exposure or vaccinations. The core is positive with the IgG that's positive, so we know it's chronic. And the HBeAg is negative. You know, again, that talks about that viral replication. So with it being negative, we know we have a low viral replication, right? So again, the answer is A, chronic hepatitis B with low viral replication. All right, you guys, I wanted to run those similar questions back to you just to make sure that you're getting it with the hepatitis B serology as I received so many questions on this. So I'm hoping that you have found this helpful. But as always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And as always, if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked here in the bio of this channel, including my website. And as always, if you're looking to book any of my one on one sessions, any of my question analysis sessions, any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.